1. Good morning, Canada, and good morning, Dr. Raj. Thank you for being with us. I know you're not feeling well, but still hats off to you for joining us for this video. So today, Dr. Raj, you would be giving us an intro regarding the IELTS, which is necessary for MCCQE1. I suppose you need to have that to be able to, skillfully attempt the exam, although it is not a compulsion by the MCCQE, by the Medical Council of Canada. Am I correct?
Yes, it is not a compulsory, but if you want to practice in Canada, so either if you want to do a practice ready assessment or a residency in Canada, then you must have done academic IELTS.
So in any way, one must have passed this exam before they can work in Canada.
Yeah, if you want to work in your profession, yes,
right.
Sure.
Okay, so now handing over to you, Dr. Raj. Please begin your presentation or whatever you're gonna enlighten us regarding.
Okay, sounds good. So yeah, academic IELTS is very important if you want to practice as a physician in Canada. So like it's required for almost every program. You can do the exams without it, but if you want to get a residency or if you want to even become a clinical assistant or do a practice ready assessment, everyone's going to ask you for your IELTS. But there's exemption depending upon where you did your medical college, but most of us have to do IELTS. The tricky part is for IELTS is like for other exams we prepare because we think we need to be prepared, but for IELTS everyone thinks it's something easy. People don't care about it, but I have like experienced many of my colleagues did IELTS, but they couldn't succeed even fourth or fifth time.
Oh wow, okay.
So I know some of my known they are doing 10th time. The tricky part is that people are okay with the IELTS except its writing part. In order to practice in Canada or if you're applying for residency, you need to have a 7 in each component.
Wow, okay, that is exactly like the UK PLAB, if I'm not mistaken.
I don't have knowledge about that. So
okay.
I'm sure you're
no
right.
problem. Sorry for putting you on the spot.
No,
Okay.
like I'm not gonna lie something. So
Okay, yeah.
I don't know something, that means I don't know something.
Okay.
Yeah, so you must have a 7 in each component, and most of us can do every component except writing. And I know many of us are just stuck at 6.5 for writing. You know, natives like native English speakers don't get 7 on writing. It's a 6.5. That's where people get stuck.
Okay.
All right, so that's what we'll discuss today, and I'll discuss each part of the IELTS. So let's go for here. So yeah, like I said, we has 4 components: listening, reading, writing, speaking, and we must need 7 in each component.
Okay.
So it's not an overall 7, it's 7 in each. That's a tricky part.
Yeah, that's tough. That's tough.
Yes. So like I know most of us can get 7, 7.5, even 8, but when it comes to writing, that's when people have hard time doing this. All right, so first part is a listening. It's divided into 4 parts. Each part has 10 questions. Questions can be anything like a fill in a blank, label a diagram, multiple choice question. And here, the important part is spelling. It counts.
Okay. Yeah, definitely. They do definitely count.
So if you spell something wrong, you're gonna lose a mark for that. Okay, and you need to have you're gonna get 30 minutes. So, and in order to get a band 7, you must have at least 31 questions right out of 40.
Okay. Yeah. for the academic. Yeah.
Yes. All right. Then comes to reading. Reading is bit tough compared to listening or speaking, but people find it's okay with the practice. For the reading, then you have, sorry, it should have 3 sections, not 2 here. Sorry. It's a 3 section, and each section has 13 questions. 2 of will have a 13 question and 1 will have a 14 question, making total 40 questions.
Yeah.
And then again, questions can be anything, multiple choice question, fill in the blanks, diagram. People find these questions are okay, multiple choice question, fill in the blanks and diagram. But there's other questions like matching paragraph heading. That's like, from my experience, that's the one of the difficult thing with reading.
I agree with you, because when I took my IELTS, I found reading to be quite tricky, because some of the things were quite difficult to find. I totally agree with you. Yes, yes.
Yeah, like you can easily do the multiple choice question or level diagrams, but when it comes to matching paragraph headings, that's, I feel like that's where most of us have difficulties. And the second difficulty is around this question: true, false, not given. And it's a not given part is very tricky there. Sometimes they put the same question in order like yes, no, not given. And the thing is, not given tricks us, so because sometimes whatever we're looking for, it's not there.
Yeah, true. That is what we think we are. Yeah, I agree. Yes.
So I would say, like, practice a lot with these 2 types of questions. The other ones are not as bad as these 2 types. And the reading usually takes about 1 hour. And then for band 7, you need to have at least 31 questions right out of 40. Okay. And then the toughest part is writing. This is the most difficult part for
Indeed,
all
it
of
is.
us. All of us. So here it has 2 tasks, task 1 and task 2. So task 1 counts about a 33%, and task 2, 67%. So I would say focus more on task 2. And for task 1, you need to have about 150 words. You need to write about 150 words, and task 2 is 250 words. And task 1 is something like you will be given a paragraph or line chart or pie chart or diagram. It could be a map. So you just need to write about that. So it will be simple as that. Oh, there's 2 graphs. They will just say write a 150 words just to compare these 2 graphs. So see what's common there, what's like differences in between these 2 graphs and stuff like that. On the other hand, task 2 is 250 words. And it could be in any form. It could be a discussion essay. It could be a disadvantage versus advantages. It could be problem and solution essay, or it could be just opinion. So you need to have 250 words for that one. What I would say, focus on your tasks 2, like do a lot of practice. You will be fine, I guess. Yeah, this is like one of the challenging part of the IELTS for most of us.
Yeah.
The second challenge is they want a specific style or format. So not everyone is used to that. So yeah, this is where we need to focus, I would say. Let me see. Yeah, I could definitely go a few more things in different video or something like that. But maybe you can just make one on just writing part of this IELTS. But yeah, this is most challenging part for us. I feel like I'm repeating myself over again and again, but that's true.
So maybe Dr. Raj, today, like, you are summarizing everything, and maybe we can summarize this IELTS as well, and along with the summary of this IELTS, I think the most important thing that people would like to know is like in what aspects and what regard would they be needing IELTS concerning Canada? Like earlier in the beginning, we spoke IELTS is necessary for immigration purposes, IELTS is necessary for CARMS, IELTS is necessary for your job application, but it's not important for the examination. So after the summary, maybe it would be great coming from you. You can summarize on that as well.
Yeah, sure. As
Okay.
far as I know, IELTS, like academic IELTS, is not required for immigration purposes. I know some of my friends are applying for immigration, and they are just doing a general IELTS.
Oh, okay. Okay. And not academic.
Like according to my knowledge, it's general IELTS for immigration purposes, but academic is if you wanna continue with your studies here or wanna pursue further in your career in Canada.
So if I may ask, that means you have to take IELTS twice, once for your immigration and once for your CARMS?
Well, you can do immigration, you can just do academic if you think you can do it. But usually IELTS expires in 2 years, and you're probably gonna have to do it again because it usually takes 2 years of time for people to do the exams, right?
Okay. Yeah. Yeah.
So like if someone is applying for immigration, I did my IELTS today, at least gonna take me about a year to get to Canada, and then another year to do exams and stuff like it will be definitely more than 2 years before you apply for a residency or other.
Pretty much.
Like,
Yeah. Yeah. Okay.
so
Yes.
most likely everyone's gonna have to do it again.
Sure.
Okay. All right. Last part is the speaking part. It usually takes about 10 to 15 minutes. The first part is like an introduction. Mostly people will say, tell me about yourself. So you can always be prepared, had just 1 or 2 minutes describing yourself. What do you do? Where you live, stuff like that. And then second part is a topic. They will give you a topic and 1 minute to think about it. So it could be anything. It could be like, what are your dreams? You can write about it, my dreams. So how do you pursue on that? Have you reached where you wanted to be with your dreams and stuff like that? And then for 2 minutes you will be talking about that specific topic, answering those questions. And then that will be for 2 minutes. No one's gonna interrupt you or ask you questions in between. And then final is the topic discussion. So whatever the topic you were given, they will do a further discussion on that. That would be the last part or third part of the speaking. So yeah, so that's pretty much it for IELTS. So that's pretty much that's a summary for IELTS, I guess.
Okay,
And
that is, yeah, that's pretty much the summary, the basic stuff that I guess everybody knows, and then we are just telling them again, considering why we need to take IELTS. So as we were saying, just to summarize today, the purpose or the aim of today's video is IELTS and the role of IELTS and the MCC examinations. So basically, MCC examination do not require the candidate to be having IELTS examination when they undertake the exam. But we still need to take IELTS because of the CARMS application. Dr. Raj, did you apply for your CARMS application and did you take your IELTS at the time?
I'm gonna apply, and yes, I am planning to take IELTS. That's the tricky part. Like last year, I didn't take IELTS because most of my education is done in here in Canada. So I assumed that I was not required to do IELTS. But later they find out only because my medical college is not, well, it wasn't in English, but according to them, the primary language of my medical college was not English. So
Wow.
that's the reason they said like I have to do IELTS. So now I'm
So
gonna do
that's
IELTS.
very interesting, Dr. Raj. Even though you have been living in Canada for many years and you have been working in Canada for many years, prior to applying for CARMS, you still
Actually,
need to
my high
take,
school is Canadian. They still
sorry?
don't want my high school, my middle school, my high school is Canadian, but they still want
Wow.
me to do IELTS.
Because you are an immigrant. Is that the reason?
No, that's not the reason. A reason is my medical college was not in English. Like we did everything in English, but the according to the rules, the primary language of my medical college is not English.
Right. And they need you to take academic.
Yes.
Okay. So very interesting point. I'm sure that will be handy for a lot of people. Okay. So
Yeah.
another, yeah, please go on.
No, go ahead.
Yeah. So that is one thing. Another thing, let's just say somebody who is a native speaker. Let's just say somebody is from either US or somebody's from UK or somebody's from South Africa, or Australia, and countries where majority of people speak English, but they graduated from countries like maybe India or maybe China or maybe Cuba. The point I'm trying to make is countries where they do not speak English in majority. So that means they would also need to take IELTS if they want to apply for CARMS.
Yes, exactly.
Wow.
So doesn't matter you're a native speaker or not. If your medical college primary language was not English, then you are required to do IELTS. I think you can go to World Directory of Medical Colleges to see if your primary language is in English or not. If your college's primary language is English or not. So it's written there on World Directory of Medical Colleges.
All right, that is the way to know. We go to the World Directory of Medical Colleges, and in front of the college, you see medium of instructions.
Yes.
Right. And
So
if you don't mind me asking, you graduated from which university?
I graduated from India.
Okay, India. Any specific university?
It's a Baba Farid Medical College of,
All right. Baba Farid. Yep.
yeah.
Okay.
So like our teaching was English. The only primary language when talking to patients was not English.
Right. Okay. So that means your rotation years, maybe your fourth year and fifth year would be not in English because you were speaking with patients more.
Yes, pretty much.
Right.
Yeah, but like Canada really doesn't matter what language you like. Doesn't matter how long you've been speaking English. Like I said, my middle school, my high school is Canadian. I did my Bachelor of Science here in Canada from McMaster University. But they still wanted me to do IELTS because my medical college was not in English.
Okay, fair enough. That is very enlightening, and okay, I must stop here. But we are ready. Our time of 10 minutes is crossing, I suppose. And just to end this video, would you like to anything? Give us a bottom line. Anything you would like to say before we end this?
Yeah, I would say just like it is a little bit difficult to do academic IELTS, but we just need to focus on the writing part. Just there's a lot of practice resources out there. You can, I would always say, like, just do some of that stuff there and practice yourself, and I'm sure everyone's gonna do fine.
That's great. That's great. And just to add on, guys, whoever is watching, please keep us updated, posted if you need any info regarding the MCCQE examinations, part 1, NAC OSCE, or regarding your CARMS application, or regarding your resume formation, or for your IELTS or your jobs. We would be happy to help you. Dr. Raj is here with us on this MCCQE group. Please join us. please join us at our multiple formats that we have over Facebook, YouTube, our Twitter page, and you can you can reach us through these platforms. So please, that would be it, Dr. Raj. I'm sure we would be coming again with another video sometime soon, and at that time we would have some interesting topic or more interesting information regarding issues.
It sounds good. Thank you so much.
Okay, thank you so much, Dr. Raj.